Good afternoon, everybody. Christine Barconi here in the NBC4i Streaming Center. It is Tuesday at 2 o'clock, so that means Governor Mike DeWine is getting ready to start his regular press conference. Hold on, we got a little bit of an echo right now. Let me fix that. The governor is approaching the podium right now. Let's go in and listen to him.
We are blessed in Ohio to have some amazing hospitals. And so I wear this to honor all the first line workers, doctors, nurses, everyone who makes all our hospitals work every single day for us around the state of Ohio. Today, I think we should pause and talk a little bit about where we are in this coronavirus and where we're going. In a sense, you could liken this to halftime, middle of the game. No one knows exactly if we're in the middle, but probably not too far away from that. And I'll talk about that in a moment. But let's first go to our slides and look at the data for today. Today, we are reporting 1,447 new cases. To put this in perspective, in the last 7 days, our cases have averaged close to that, a little bit over that, 1,475 cases per day by report date. We had been averaging, to put this in perspective, a little over 1,000 cases per day only 2 weeks ago. So we've gone up quite dramatically in several weeks. Let's look at the positivity, another way of looking at this. As we increase the testing, we would hope to be seeing a drop in positivity. We're not seeing that. This is a chart that only goes back, and I want to make sure everyone understands, this goes back to July 1. So we got from July 1 basically to the present. And you can see what's happened. Our positivity is now showing for the last day 4.1%, 3.9% for the last 7-day average. It was 2.7% on September 23rd and 24th. So again, these numbers have gone up dramatically. Let's take a look at our top 88 counties. And what you will see here, again, these numbers just continue. These numbers, unfortunately, just continue to go up. Athens and Fayette County are both, and Putnam, Mercer, Dark, all those counties are about 3 times what the high incidence level of the CDC. So it's just off the charts. And then we go on down from there. So again, starting Athens, Fayette, Putnam, Mercer, Dark, Auglaize, Jackson, Butler, Henry, Miami, Fulton, Allen, Ross, Shelby, then DeGreen, Clark, Montgomery, Scioto, Lawrence, Muskingum. Those are the top counties as we move forward. This map now shows how many counties are red and how many are high incidence. So the red counties, you can see, if it's a high incidence level, that simply means that they're over 100 cases per 100,000 for every 2 weeks. So we're now seeing 51 of our counties that are high incidence counties. And that's just a real problem. What this means is we've seen this spread. And if you look at this, if you're in a high incident county or you're a red county, we certainly should be concerned. We're not trying to scare anybody, but these measures have never looked like this since we've done this. We never had as many high incidence counties, and we certainly have a lot of red counties. So if you look at, for example, the western side of the state, 2 counties in, every single county looks like it's high incidence or a red county. And this really shows just how this virus has spread out throughout the state. And again, if your county's red or high incidence, that's a big concern. So let's step back for a moment and kind of look where we are going. As I say, maybe it sort of like being at halftime. And I get questions all the time. Mike, when's this going to be over? Governor, when I can take off my mask? I'm sick of the mask. When can I do that? What's our goal? What's Halloween going to look like? What's Thanksgiving going to look like? What's Christmas going to look like? Next year, baseball, and on and on. And these are the things that we all ask ourselves. The truth is that no one can answer these questions with great certainty. What we can say is that things will get better, but in all likelihood, they will get worse before they get better. And we're already seeing that in the trend lines of the last several weeks. Virus is tough, it's cunning, it will not give up, sort of has a mind of its own. And all the experts that we talk to for months now have said, when the cold weather hits, more people move inside, we can't really be outside as much. That's when we're going to see more spread. But I think it's important for us to look at, before we look at the future, and again, no one can predict the future, but I'll base this on what the experts tell me and people I talk to. I spent all day yesterday on the phone talking to more people, many of them around the country who've been following this very, very, very closely. I think it's important, though, to talk first about what we've achieved, because we've achieved a lot. You have achieved a lot. Ohioans have done exceedingly well during this. If you compare us with other countries, if you compare us with some other states, we're doing pretty well. And what we've really avoided, because of what Ohioans have done and what they've not done, what we've really avoided is this huge spike where we would see our hospitals overflowing. We all remember first seeing those stories coming out of Italy. We've seen them come out of New York. We've seen them come out of California and Texas, Florida, more recently, Mississippi. Now we've seen high incidence up in South Dakota, North Dakota. So despite the great tragedy, 5,000 deaths, many families where both parents are out of work. We've seen small businesses close. We've seen small businesses struggle. We've seen an increase in people with mental health problems. So this virus has certainly not been benign, and we have not been spared, and the people of Ohio have not been spared. But because of what you have done, we've gotten to where we are today, and we're in better shape than we would have been if you hadn't made the sacrifices. So many of you have worn masks. No one wants to wear a mask. We all get tired of it. So many of you kept distance. So many of you have done the basic things that we know that we have to do. So I'm proud of where we are. Not proud of me, but I'm proud of what you have done. You've really made a big, big, big difference. We've avoided these large outbreaks that other countries and other states have seen. We've certainly seen more deaths than we want, more cases than we want. But we're doing well compared to many states and to countries. Let's talk now about the future. What is the future? Again, no one can predict it. But let me just talk about what the experts are telling me and best that I can discern this. We've talked in the past about it could be a tough winter. Could be a tough November, December, January, because we're moving inside. Because we're also now seeing, for the last 2 weeks, some fairly significant spread through the greater part of Ohio at a high rate. Cases up, positivity up, hospital admissions are up. Plus early first indicators, doctor visits, emergency room visits, people with COVID-like symptoms, these are going up very, very fast. But I think the thing that we should remember, we can control a lot of this. Can't control it all. Virus is not going to go away until we get the vaccine, until we get the herd immunity. But we can control and mitigate a lot of this. We've done it before, and we can do it again. Ohioans are tough. We're resilient. We're workers. We focus. When the goals are clear, when we set our sights on those goals, when we set our sights on victory, we can, in fact, do it and have done it. To paraphrase something a science reporter wrote yesterday that I read, how we come out of this, the final death toll from COVID-19, for example, how it impacts all of us with jobs and business, will really depend on both what we do, all of us do, right here in Ohio. And it will also depend on how quickly we get the vaccine and, frankly, how well it works. Most of us in Ohio are not scientists. Most of us are not involved in this effort, although some Ohioans are. So we can't, most of us, control that. But what we can control is what we do. Let's talk about what we do know about the vaccine. Look, we have every indication that President Trump's Operation Warp Speed, which is being subsidized with a lot of money, where they're subsidizing vaccine companies' clinical trials and manufacturing costs. We have every indication it's working. As the New York Times reported yesterday, the operation is, and I quote, working with remarkable efficiency. Doesn't mean there won't be glitches, doesn't mean it'll be perfect, but it seems to be coming along. And so it is coming, and judging by all the indicators, it will work. As I said, we aren't the scientists. We can't control the development of this vaccine. That's beyond our ability. The money's been put in. The right people are working on it, and they're working on it exceedingly hard. Here's what we can control. And it does come back to the basics. We can control what we do every day. We can control keeping a distance from other people. We can control whether or not we assume that other people who we are seeing might have that virus and that we back off, keep the distance. We can control, as I said, wearing the mask. We can control whether we keep the distance. We can control whether we wash our hands, whether we take all the normal precautions. And what we do collectively is going to determine, frankly, what the next few months are going to be. If we could get mask compliance up 85, 90% in this state, every county, we would fundamentally change what the next few months will be like. So as we look forward, no one knows exactly how long this is going to take with the vaccine. So we don't know how much longer we're going to have to do this. But several people I've talked to and the things I can read, indicate that, by summer, this coming summer, we could be in a position where we're getting it out, the vaccine out in a large section of our state of Ohio. What should be our goals as we move forward? We got to keep our economy moving, keeping the jobs we have, creating as many new jobs as we can, keeping our small businesses going. To do that, and to keep our deaths down, and we will have to keep this virus from flaring up. We all want to get through this alive and unhurt so we can be there for our children and grandchildren to celebrate birthdays, baptisms, weddings. Everybody has different goals. For some, it's keeping your kids in school. making it possible for them to play sports, making it possible for them to be in theater, making it possible for them to be in debate, choir, whatever their passion is. What we do in our communities will determine that, because the schools live in that environment. And if we allow that virus to flare up in our community, it is going to go into our schools. And it's the same way with our nursing homes. When nursing homes are hit, they're hit because someone is bringing that in. Not obviously on purpose, but they're coming in. And so that, what's going on in the community reflects what goes on in the nursing home. And so again, wearing a mask, keeping a distance in the community will impact our schools, our ability to keep kids in school. It will impact our ability to keep our nursing homes free of the drug, free of the virus, excuse me. Everybody's got different goals. Maybe your goal is to be back in the horseshoe with 100,000 or so of your fellow fans cheering on the Ohio State Buckeyes. Maybe your goal is to be able to go to a busy farmer's market on a beautiful Saturday morning with your family to see your neighbors, pick up some fresh produce. And I will say that that's certainly something that you can do now and is going on if you're careful. Maybe your goal is to be able to hug your best friend who has some medical problem. Whatever your version of the why is, that's what is at stake. And what we collectively do will determine our ability to do this. Our game plan. In every sport, there's a game plan. We have a game plan. Our game plan is to wear a mask when you're out. Wear a mask when you're in a place where you will see others. Stick with our game plan. Execute the plays. This is exactly how we will disrupt the virus's game plan. The virus wants us to get complacent. It needs us to spread it, and it only spreads with our help. Some friends of ours, friends of all Ohioans, did a public service ad that I think captures the greatness of Ohio, the strength of our people, and what we have to do in this second half to win.
There are moments in life when all the greats are tested.
But they persevere, adapt, and never, ever give up.
Ohio, that's you. You've saved countless lives and slowed the spread.
But we can't let up. We need to stick to our game plan because we know it works.
That way we can return to doing all the things we love and enjoy.
With our families and our friends.
Ohio, when we stick together, we always win.
It's up to all of us.
Well, we're Ohioans. Ohioans play until the end. Ohioans never, ever give up. And in the motivational words of our coaches, when Ohioans stick together, we always win. And it's up to all of us. Ohio lost two of its greatest citizens yesterday. Joe Morgan, John Ruffin. Cincinnati Reds Hall of Famer Joe Morgan was the greatest second baseman of all time. He was a great base runner, hitter, and most importantly, he was a gracious and genuinely nice person. I had the occasion to meet him, I think, twice, and he was amazingly gracious. He's a person who mastered every detail of the game of baseball. Fran and I saw him play many, many times with our older children, Pat and Jill, Becky and John. It was a thrill to watch him during the years of the Big Red Machine. Later, as an announcer, he had a unique, I think, ability to explain what was happening on the field to the average fan. Our younger kids, Brian, Alice, Mark, and Anna, probably knew him more as Mr. Sunday Night Baseball than they did even as a baseball player. He was the voice of Sunday Night Baseball. He was truly a master at explaining the why of baseball, why something happened. He also used his talents in the business world and for charitable causes right here in the state of Ohio. And we extend our condolences to his family, to his teammates, and to his friends. Yesterday, Ohio lost one of its most gifted artists with the death of John Ruffin. Born in Cincinnati, spent more than half his life living on a 165-acre farmhouse built in 1836 in Georgetown, Ohio. As a young man, John Ruffin served his country in World War II as a member of the greatest generation. Fran knew John and his late wife, Judy. It was a special thrill to visit him in his studio and to see the work that he was doing. He used his talents to paint Ohio's great varieties of animals, plants, as well as world's natural treasures. His painting of our state bird, the cardinal, was used for license plates and earned $5 million for the Ohio Division of Wildlife. In addition, John and Judy bought and helped restore President Grant's boyhood home in Georgetown, Ohio, ensuring it would be preserved for generations to come and getting it on the National Register of Historic Places. The Ruffins donated Grant's boyhood home to the History Connection, to the people of the state of Ohio in 2002. History was so important to them that John created a foundation to preserve history to honor Judy after she died. John Ruffin was often called Ohio's 20th century Audubon. This is really a fitting tribute to his talents and his lifelong dedication to sharing the beauty of Ohio's natural treasures with all of us. Another difficulty that has arisen during the coronavirus is that patients have not been able to take their children to the pediatrician for well-child visits as often as recommended. This led to a decline in the number of vaccinations administered to protect against diseases such as chickenpox, measles, whooping cough, and polio. We're starting to catch up on these numbers, but there's still some reason to be concerned. There's a danger that these diseases could easily spread if children are not vaccinated. We've seen during this pandemic just how important vaccines can be. While we do not have a vaccine for COVID-19, we can prevent more than a dozen other diseases from harming our children in our communities, and we can do that right now. I want to share this public service announcement, which you will see more in the coming months. It stresses the importance of childhood vaccines in the care of our children.
This boo-boo tells a story. It's a tale of perseverance, ingenuity, and love. This boo-boo is hundreds of years of science and technology. It's protection in the battle against disease and illness. And while we continue to fight COVID-19, childhood vaccinations are more important than ever. This boo-boo, it's love in its purest form.
In addition, in the coming days, the Ohio Department of Medicaid will launch a number of initiatives to encourage childhood immunizations among their members. These efforts will be aimed at increasing safe, convenient access to vaccinations for members by providing mobile vaccination clinics and reducing administrative barriers for providers. It's critical that Ohioans and providers remain vigilant about keeping children up to date on these vaccines. We cannot let COVID-19 prevent us from meeting our essential health care needs. Please contact your pediatrician or your health department today to schedule these important well-child visits. Today I've asked Dr. Chris Peltier, a doctor from Cincinnati Children's Medical Center, to join us to tell us more about the importance of childhood vaccines. Doctor is also a provider at Pediatric Associates of Mount Carmel and president-elect of the Ohio chapter of the American Academy of Pediatrics. Doctor, thank you very much for joining us.
Thanks for having me again, Governor.
Tell us a little bit about just in general what's going on with childhood vaccinations. I know that some doctors have expressed some concerns about maybe not having enough families come in yet, and maybe tell us a little bit about what you're seeing, but also just tell us the basics. Tell us why is this very important?
Definitely, I'd be glad to. So as a result of the pandemic, as you mentioned, vaccine rates are definitely plummeting, not only here in Ohio, but across the country. We know that during the shutdown last spring, well-child visits to pediatricians fell, which ultimately, in addition to many other things like not being able to do vision and hearing screens, ultimately dropped the rates of vaccinations. Many families were obviously worried about going to their pediatrician or their family doctor. Was it safe? And we know, I want to share with you some data. So from January through April, the CDC reported a cumulative decrease in 2.5 million doses of vaccines that were administered. And just looking at the measles, mumps, rubella vaccine, the CDC noted a national decrease in over 350,000 visits. There's a national group of independent pediatricians that it really involves about 1,000 pediatricians that share the same electronic health record. And some data from that company showed that decreases in the diphtheria, tetanus, and whooping cough vaccine dropped almost 50% up through April. And the HPV or human papillomavirus vaccine rates dropped by almost 75%. As you said, it definitely is improving, and we are seeing well visits return to higher levels than they were during the spring, but in many practices, that's still not up to 100% or where it's been. And not only that, but now we're having to try to get in families that delayed their well child visits and their vaccinations when Ohio was shut down.
So why is it important? I mean, I think we all know just intuitively this is important, but what are the consequences if our numbers are not where they need to be and if we don't hit a certain level of children with these vaccinations?
Right, so the ultimate outcome is that we run the risk of an outbreak of vaccine preventable illnesses like whooping cough, like measles, and a worsening flu epidemic than we normally would have. You may have seen the American Academy of Pediatrics has an infographic that they've been publishing on social media trying to prevent what they call a twindemic. So, you very sadly demonstrated where we're at in the fight against COVID. We are at the very beginning of influenza season. And, we worry that if we aren't vaccinating against things like measles, whooping cough, influenza, we're going to see greater closures in schools. We're going to have more impact on the economic outcomes for parents and caregivers. And I think most importantly, there's going to be a strain on the already taxed health system due to COVID to care for these children. There's an interesting study that was published recently in the European journal Lancet that really looked at trying to put in perspective. And what the data that they found showed that for parents that are worried about bringing their children to their pediatrician for risk of getting COVID, for every one death that could be attributed to COVID that could potentially be caught by going to your healthcare provider in delaying vaccinations, 84 deaths in children could be prevented from other vaccine preventable illnesses like whooping cough, measles, and flu. Now, of course, we're not, one death is too many, but it just sort of puts it in perspective when we're saying, if a parent doesn't want to bring their child to the pediatrician for fear they may get exposed to COVID, that one possible prevention of a death could result in 84 other preventable deaths due to other illnesses. Failure to vaccinate against these kids, or failure to vaccinate against these diseases leaves our Ohio children unnecessarily vulnerable. And with COVID-19 transmissions running high, as you so eloquently stated at the beginning of this press conference, it's more important to vaccinate kids against all preventable vaccine illnesses, but also influenza. And the American Academy of Pediatrics recommends that everybody aged 6 months and up should be vaccinated against influenza, ideally by Halloween. We have the Ohio AAP has a social media campaign right now, no boo without flu. So trying to get your flu vaccine by Halloween.
And the whooping cough is not something that we think exists anymore, but it does, right? We've had, occasionally there's an outbreak that you'll see somewhere in the country, and sometimes maybe even in Ohio, I think. So
we see outbreaks every year. It's probably the most common vaccine preventable illness that we see. Every year we have outbreaks in our local schools.
And the significance of whooping cough is what? Tell us about it.
So, it in older children, it can cause what's known as the 100-day cough. So kids can have sort of this nagging cough. They may feel sick. The biggest thing is they're contagious, so they have to be isolated during their contagious period. The real risk is in young infants and babies, and that whooping cough can cause young infants to stop breathing, and ultimately we see deaths every year from whooping cough in young infants.
Wow. and pretty much preventable, right?
Exactly.
Doctor, thank you for joining us.
You're welcome.
Last question. If anybody's watching this and they have a child, who can they contact if they don't have a doctor? What do they do?
Well, so I'm going to just, before I answer that question, I will say for those families that do have a pediatrician, ask your pediatrician, make sure you're up to date. When you don't just save vaccines for well visits. If you're coming in for an ill visit, ask your pediatrician, am I up to date on my vaccines? Can I get a flu shot today? Pediatricians' offices are safe. They're open. We have flu vaccine and we have all of the other vaccines that children need. If you don't have a primary care provider, I would recommend families go to their local health department. They can go to the health department and get vaccines. Vaccines at both your pediatricians as well as your local health department are completely free of charge. And Ohio has a vaccine registry program that my office participates in, all of the county health departments participate in. And even if you don't have a copy of your child's shot record and you don't know which vaccines your child may be due for, your pediatrician or the county health department can go into that impact vaccine registry and see what vaccines your child is due for.
Doctor, thanks for joining us again.
Thank you very
Appreciate it very much. Today, we're launching a new dashboard that we hope will be a valuable resource for private entities who are administering COVID-19 tests. We know that pharmacists, nursing homes, colleges, universities, employers, and others are now administering tests, but they may struggle to find a lab to run their samples. Our new lab capacity dashboard provides self-reported information about labs that can run tests, including hours of operation, types of tests that they accept, estimated turnaround time, and locations. It's accessible on our COVID-19 dashboard at coronavirus.ohio.gov under the Other Resources tab, labs with available capacity can sign up to be included in this dashboard by linking to a form on the webpage. This new resource will help connect groups that are testing with available labs in order to ease turnaround times and inform Ohioans their COVID-19 status. Many of you may have heard about the Binax Now testing. These are 150 million Abbott Binax Now COVID-19 tests that the federal government purchased and are now distributing to the states. As I said, 150 million of these are now being distributed. We received our first shipment a few days ago. These low-cost tests provide a rapid response and are an important step towards ramping up testing at the kind of scale we need in order to limit the spread of the virus. My team and I have been working to determine how to incorporate these antigen tests into our state testing strategy, and we've been consulting doctors and other health experts. We have now started, as I said, to receive these tests. Beginning this week, we are deploying some of these tests to our colleges and to our universities to help them implement the proactive screening plan that we recommend. In addition, we plan to aggressively deploy these tests to our nursing homes. As we know, nursing homes must comply with very significant federal testing requirements. And given the vulnerability of residents, nursing homes have been our priority for testing since the beginning of the pandemic. We're working with the nursing home industry to integrate these tests into our existing testing plan in the most strategic and effective way, and we'll be announcing more of the details as we move forward. Next week, we'll begin sending thousands of these tests to nursing homes for both routine and outbreak testing requirements. As we implement these strategies, we will continue to evaluate our supply of these tests and where they can move the needle in the fight against this virus. I also want to say two things as we begin ramping up the use of these particular tests. First, we have discussed before that lab-based PCR tests are certainly the gold standard and provide the most accurate results. Antigen tests, the Binax tests, and others can have some level of false positives and false negatives. This is a trade-off with having tests that allow us to do some screening testing. We do have protocols to follow up on test results. They're most likely to be false, but we need to be aware that this is part of testing at this scale. The opportunity to test more broadly and more often makes this an important step forward in our fight against COVID-19 spread, even with the lower sensitivity and specificity of these tests. Finally, I want to emphasize that no test, not antigen tests, not PCR, are a substitute. Nothing is a substitute for the precautions that we talk about every single day. Wearing masks, social distancing, avoiding large gatherings. And when someone gets a negative test, the great fear that doctors express to us and scientists express to us is that that person will instantly in their head say, hey, I'm home safe, I'm free, and stop wearing a mask or stop social distancing. That is just the opposite of what should happen. Getting a negative test is not a green light to let your guard down. It's a look at your status at one single point in time. Testing is an important tool, but if we're truly going to stay ahead of COVID, it will be through acting responsibly and taking care of each other. There was another tragic week in our state with at least 16 more people killed in Ohio as a result of gun violence. An additional 22 people were shot, including a baby in a stroller. It happened in Cleveland. 5-month-old infant, 18-year-old, hospitalized after being shot on Cleveland's east side. According to reports, someone in a car opened fire, hitting the teen who was outside his home. One of the rounds also entered the house where the baby was in his stroller. Both victims suffered gunshot wounds to the stomach. It's just absolutely senseless. This infant has been on this earth just a few months and already a victim of gun violence. According to the Columbus Dispatch, which is doing a series of reports focused on gun violence in central Ohio, 48 children younger than 16 were treated at Nationwide Children's Hospital in Columbus for gunshot wounds from January through September of this year. 48 children. The report points out that minority children are twice as likely to be shot than Caucasian children. This is just horrific. This is unacceptable. Legislation pending with the General Assembly will help prevent some of these needless shootings. Here are a few more headlines from the past 7 days. 7 days. In Trumbull County, dispute over money led to shooting in Fowler. According to reports, the suspect shot the victim in the torso and neck. The alleged gunman is now facing multiple charges, including having weapons under disability, meaning he was prohibited by law from having a gun. Before that, in Columbus, friends mourn loss of 23-year-old Ohio State student killed in shooting. This happened on Sunday. A marketing major at Ohio State was shot to death outside of a former fraternity house in the University District. Reports say the shooting stemmed from an argument related to a party. According to court records, the alleged gunman was out on bond, awaiting sentencing after pleading guilty to a felony burglary charge. Because of this pending case, the suspect, under current law, could legally not possess a gun. Yet, he allegedly did so anyway, violating Ohio's weak law on criminals possessing guns, a law that we have to toughen. Now a college student is dead. We must strengthen Ohio's laws as they relate to convicted felons. This is not hard. What we're simply saying is let's model Ohio's law after the federal law. And so someone is convicted of a violent offense in Ohio. They already lose their right to have a gun. What our bill would simply say is that that judge, after that person's been found guilty, if they're found guilty of being a criminal convicted of a violent offense first, and then being in possession of a gun, again, the judge could impose a very heavy sentence. We don't mandate the judge do it, but we give the judges the opportunity to do it. Our bill is pretty simple, and it's something that we know will pull some of these violent offenders off our streets. A study that we did when I was the Attorney General, done at Ohio State University. We went back to the 1977, from then on until today. And what we found, or until that period of time, and what we found is the vast majority of violent crimes are committed by a very small percentage of our criminal element. It's those individuals that we simply have to target. That's what our bill does. This bill was introduced by Senator Matt Dolan last October, and it would have prevented some, at least, of these violent crimes that are occurring. I think we're ready for questions.
Governor, first question today will be from Jim Oddie at WHIO in Dayton.
Hey, Jim.
Governor, good afternoon. I want to take you back to your original statement. This is about the terrible threshold that we've reached now, over 5,000 deaths. Going back to March when this all began, did you ever imagine we would get to this point, ever? And secondly, do you have any inkling as to what percentage of the 5,000, perhaps those people, those victims, had other medical problems, other complications, in some way to put this in perspective so that people understand who is actually suffering the most from this?
Well, Jim, first of all, I don't think any of us had an idea where this was going. We saw some projections. Some of the projections were higher than this. I think it's a tribute to the people of the state of Ohio that it hasn't been more than this. If we wouldn't have been wearing masks, people would not have been careful initially, if they had not basically isolated, then when we opened the economy back up, if they hadn't been, many of them wearing masks as they are today, these deaths numbers would have been significantly higher. I don't think there's any doubt about that. But no, I mean, it was hard to envision, that many deaths. As far as what percentage of these 5,000 people had another medical problem, I can't answer that, but we do know that a large number of those individuals were over 70. We also know that many of them who, let's say, were not over 70 had some other medical problem. So I think that's pretty plain. But it doesn't, at least for me, and I hope for most people, change the fact that these were fellow Ohioans who were alive, who had people who loved them, who had a life ahead, who seemed to be doing okay, and some of whom may have lived many years. And they were taken away from us by this vicious virus. So each one of these lives is precious. And I know you did not say this, but sometimes people say to me, well, he was over 70, or he was sick already, or she was sick already. Well, they're still human beings. They still have people that love them. They love people. They had a future. They wanted a future. Their family wanted them around. And sadly, they are gone. That is not to mention, when we talk about the 5,000, that's not to mention the people who've just gone through hell. And we've had several of them on Skyped in who thought they might die, who were separated from their family for months, and who made it. And so we're blessed to have them back, but they suffered greatly. We also have people who have recovered, but who have long-term damage, lung capacity, some organ damage. So the 5,000 is, each one's a person, each one's a picture, each one, was a great tragedy. But there's also a lot of other people among us who have suffered and who don't show up in that column, but they certainly come in another column.
Next question is from Dustin Ensinger at Gongwer News Service.
Good afternoon, Governor.
Afternoon.
The state has so far managed to avoid tapping into the rainy day fund, but you previously said that you expect to use all $2.7 billion. Is that still the plan? And do you have any specifics on where you would like to use that money to fill gaps?
Well, money's fungible. I mean, you can move it around. It's going to enable us to provide basic services, starting with education, to the citizens of the state of Ohio. So we've taken a conservative approach. I'll be honest about that. We think, while I'm optimistic about what's going to happen, whether it's next July or whenever it is, that this virus, we have the herd immunity and we're, moving forward even a lot faster than we are today. I think we're going to rebound fast. I think we're going to come back, but I don't know that for sure. And, we're going to spend all this, we believe we'll spend all this money over the next several years. And it will be there primarily to do what a rainy day fund is for, and that is to make sure that basic services are provided to the people of Ohio, particularly those people who are the most in need. And so our plan has not changed. Our plan would be to spend it, probably spend all of it, but spend it over a period of probably a couple of years. You know, what we did to get through the first, to end up last year, you know, we made some cuts. And, you know, we pulled some other things back in. We did a hiring freeze. We did other things. We got on top of it early. But we wanted to save this money, frankly, so that we could level that out as we move forward. And that's still our goal.
Next question is from Jeff Reddick at WSYX in Columbus.
Good afternoon again, Governor. Two
Jeff.
questions for you. One of them being, you said a lot off the top about it's going to get rough. We need to prepare to get rough. You've said in the past we won't shut the economy down again. Would that be in any way no restrictions on businesses that would cause shutdowns? Secondly, we're seeing a lot about the state's R0 number going up. Could you go over what you know of it? Is it continuing to rise?
Yeah, the R0 number is about 2 weeks behind, just by its nature. And so, yeah, you're seeing it go up. It is, we don't like that. It's above 1 statewide, but not a lot above 1 statewide. But again, it's really a lagging number. And it's an important number. We look at it. It's on my 42 pages that I get every morning when I get up. But it's, you know, it's one of many indicators. I mean, it's one of the indicators. When I said every indicator is going the wrong way, that included the R0 number, which is what that spread is. You referenced the first part of your question, I think, to, you know, potential shutdown. And let me just make it real clear. When I said we're going to have a tough winter, this is pretty much what, you know, we're seeing numbers go the wrong way in Ohio. And by the way, we're not alone. We're seeing these numbers. I talked to a number of governors yesterday on the phone, Midwest governors. I talked to Governor Cuomo, talked to Governor Beshear, Whitmer, and on. And these states a lot of these states, particularly in the Midwest, are seeing the same things we're seeing. They're seeing a real upswing in the rural areas, generally more than the urban, and they're seeing an increase in cases. So we're all kind of seeing the same thing. But we can, the point that I want to make sure I get across is that when I say it's going to be a rough winter, it could be a rough winter, it's based on 2 things: the numbers we're seeing now and what the experts say what happens when you move inside. But we can mitigate that a lot. We can change that future dramatically. And I will say what I've said other times. While we have, in some areas of the state, very good mask wearing, I was on the phone this morning with most of our health directors, and in some counties, they're seeing a retrenchment. They're seeing that mask wearing go down a little bit. And, you know, if we can keep it up, if we could do 85% or so statewide, every county, this winter will be a lot easier. And what really is at stake is all the things we value. And it's not going to be whether I shut the state down or don't shut the state down. If the outbreak is so bad that you can't put teachers in a classroom, that you can't put students in a classroom, these kids will be learning remotely. Whatever the school wants to do, they will ultimately make that decision out of necessity. If the outbreak is bad, people will become even more nervous, will become nervous about going out, and they'll become nervous about spending money. And so all of these things, so much of our economy and so much of our future during the next 3 months or so depends on what we do. You know, I talked about 2 things are coming together. Never in the history of the country or the world, as far as I know, as vaccines have been put together this quickly. And we're not there yet, but it looks like, you talk to the experts, that we're on a pathway. So we're going to get these. And we can't control that. That's what other people are doing. But what we can control is what we do ourselves. And that is back to basics. One of the things I loved about the coach's ad is because in this, as in all sports, it does come down really to your optimism, to your heart, and it comes back to doing the basics. Every sport, everything you do in life, it's about doing the basics. We know what the basics are here. And if we can do these basics, we will change that outcome. So I didn't come here today on this absolutely beautiful day in Ohio to talk gloom. I'm optimistic. We've done well, but it's a crucial period. Numbers are going the wrong way. We're coming into winter. And so we got to buckle down and we got to do what we need to do. And when we do that, that mask again becomes our ticket. It's our ticket for our kids to play ball, our grandkids, in my case. It's our ticket for kids to be in school in person. It's our ticket to be able to go out and about. It's our ticket to be able to go to a restaurant, go to a bar. That's what our ticket is. And if enough of us wear it, we'll have the ability to do that. If we don't, it could be a tough winter. So the choice lies with us. It really does. All of us collectively. 11.7 million Ohioans. It really comes down to what we do.
Next question is from Joe Ingles at Ohio Public Radio and Television.
Good afternoon, Governor.
Hey, Joe.
I know you've said that you feel like the freedom of speech should be, or political speech should be protected when candidates are coming to Ohio. But in many cases, and especially cases involving President Trump and Republican rallies, the people who come don't observe the mask mandate. The presenters themselves don't observe the mask mandate. They ignore distance spacing. And every time they come to Ohio, employees, people who are not part of the event, people who have nothing to do with having a choice to be there, have to work in those conditions where that's not being practiced. You are friends with the Republican leaders. Have you talked to them to at least urge them to follow the protocol? And have you talked to the president to ask him to try to get people to wear masks and practice more safe distancing and that sort of thing?
Yeah, it's no secret what my position is on masks. I mean, everybody in Ohio is sick of me talking about masks. And I think, they understand at the White House what my position is as well. But, Joe, I want to take it one step further. What you just said about a rally is the same thing about any other gathering. And that is that people who don't wear a mask, it's not just about protecting themselves. By not wearing a mask, they could very well be endangering other people who they don't know, who aren't related to, let alone to the people they're related to. So, our message has been clear, crystal clear, from Black Lives Matter, from demonstrations, to Trump rallies, to church gatherings, and that has been, please wear a mask. And the evidence is overwhelming. The jury is returned. It is a unanimous verdict, and that is that masks do in fact work. And there is some evidence now that not only do they help the other person, not only do they help you getting it, but if you're wearing a mask, and let's say you're out, and the other person maybe is not wearing a mask, you get some of this. There's some indication from some scientists that the severity of how well or how much you suffer, how severe is that case, may be related, may be mitigated and taken down by that mask. So we're clear on the message. We can't control everything. The biggest cause of spread that we're seeing is people, when they're with friends and family, places they feel comfortable, And, you know, they let their guard down, as we all do when when we're with friends and we're with family, we all let our guard down. But the message is we can't do that. We've got to assume that everybody has it, even our friends and even our family, because we don't know. We just don't know.
Next question is from Laura Hancock at cleveland.com.
Good afternoon, Governor.
Afternoon, Laura. I think we lost you.
Governor, if we are heading toward a second wave, what prediction or what preparations is the state making, Department of Health, your administration, et cetera, to kind of head some of that off?
Yeah, I mean, we're on the phone every few days with our hospital leads in our 3 big regions of the state. We're talking to other hospitals around the state. National Guard is involved. So, you know, because we went through this in the spring, you know, everybody knows what they do if the hospitalization rates go up and we get more people in ICU and more people, you know, who have to be on ventilators, for example. So what we're seeing so far is an increase in hospitalization. No area yet is threatened. None of our 8 zones are threatened, but everybody's prepared. Everybody knows what they'll do in case of a calamity. So team's ready. We don't have to have that happen. Not only don't we have that happen, we can keep this virus at a slow burn until we get, until the firemen come, men and women, the fire department come and put it out. And that's when the vaccine is here and we get widespread use of the vaccine. But until the firemen get here, we've got to control it ourselves. And we control it ourselves with mask and distance. And I cannot underestimate or can't state strongly enough, we have it in our hands to control how much this flares up. When you saw those counties, and some counties at 3 times now, the level of high incidence, 3 times. It doesn't have to be that way. If tomorrow, everybody in those counties, those top 10 counties, 20 counties, 30 counties, everybody put on a mask, everyone keep a distance, you can knock this thing down in 2 weeks and your numbers would start going down. There's absolutely no doubt about it. We've seen it happen in Ohio time and time again. When a community has done that, the cases go down. It's not rocket science.
Next question is from Danny Eldridge at Hannah News Service.
Hello, Governor. So there's about $900 million left in the state share of the CARES Act. Can you talk a little bit about what your plans are for that money? I know arts groups in particular are looking for funding from that.
Yeah, we hope to have some money. We will have some money for the arts. We'll have some, because we know they've been hit very hard. We hope to have some money for other nonprofits. We hope to have money for other small businesses. And we hope to have money for people who are paying rent and are behind in their rent or behind in their mortgage. So those are, we've already put some money out in regard to mental health, and we're monitoring that. You know, we put out the money that we think can be spent between now and the end of the year. If this money can be carried over, which we hope it will be, and we think that Congress in a lame duck session will vote on a bill. If they vote on any bill, I'm told by our congressional delegation, there will be a rollover provision in the bill. And then we'll be able to take some of that money into next year when we're also going to have mental health concerns, where our colleges are also going to need additional funds. So for this year, in addition to the things I talked about, we also look to have some additional money for our colleges and our universities. So we have plans. What makes it difficult is we still don't know for sure whether we can roll this money over or whether we would be in a position of trying to spend it between now and the end of the year, which would not be a prudent way to do it. It would not be the most logical way to do that. So we're kind of balancing these things, but we have needs now that we're going to get covered. We're working with the state legislature, and we should have a specific announcement about what we're doing shortly.
Next question is from Boniface Wammer at Eye on Ohio.
Good afternoon, Governor. My question for you is going back to the vaccinations. When you finally receive a vaccination, how long do you expect it to take before you can roll it out to all of Ohio?
Well, that's an excellent question. I don't know the answer, but I have a general answer. And this is from talking to the vice president and talking to doctors. We think that these vaccinations will come in waves. And it looks like most of the ones that are being worked on require 2 shots. I think one of the main ones being worked on is a 3-week period between the first shot and the second shot. Another one is a 4-week period between the first shot and the second shot. Some of them require deep freeze, but they're going to come out in containers that can hold them. We've already are working on the distribution chain. We would expect that the first group that would come out, will certainly be focused on critical first responders, and by that I mean people who are right on the front line. It also, very early on will be people who are the most vulnerable. That certainly is anybody who's living in people who are living in a congregate setting, such as nursing homes. So we think it's going to come out in waves, and it's going to pick up faster and faster, probably as it goes. No one knows how long this is going to take, but several knowledgeable people who've looked at this have told me by June or late June, they would project that we would be in widespread distribution, to people all over the country, not just in niche groups or smaller groups, but it would be widespread. Now, look, those dates are just, no one really knows. People are trying to kind of figure it out. But, we're moving towards, working on it. So no matter when it comes out, we'll be ready to get it out. And our goal will be to, obviously get these out just as soon as we get our hands on them.
Next question is from Max Philby at the Columbus Dispatch.
Max.
Hey, Governor. I remember a month ago you were warning Ohioans with Labor Day approaching that if they weren't careful, we could see cases spike again. So I'm curious if you believe that the spike we're currently seeing is the result of Labor Day, and if that could lead to any more measures that your administration might implement since we've got a few more holiday weekends coming up before the end of the year.
Yeah, I think, Max, that's too simplistic. Certainly Labor Day and activities could have been a partial cause. You had a lot of things going on, as you know, in the week or two before. Schools were opening back up and colleges were opening back up. And our colleges have kind of phased in. Some of the colleges opened up entirely in person, some kind of phased that in. So we're well into all of that now. What we think we're seeing, as we're seeing an uptick now in the age, which is different than it's been for a number of months, that we're seeing kind of a rebound. So, you get a 20-year-old college student who has got infected, he or she, might not even know they have it. They pass it on to an older person. And we think we're seeing that second phase of that possibly taking place. But it's very difficult to drill down and to quantify that. So, again, you asked, your other question was, is that going to inform us to do anything in particular? And what it informs me to do is to just emphasize to people, we control this. This is in our collective hands. I mean, when you think about it, if we're correct that so much of this is coming about from people who are with family and with friends, whether at a wedding or a funeral or a barbecue or any kind of things that people do, government has very little way to impact that other than to tell people, here's what's going on in your county. Here are the numbers in your county. And second, here's what you can do about it. And, telling them, we know this works. We have evidence that works. We have evidence in Ohio it works, as well as national evidence. So, if you just listen to the experts, you know, I think it was Dr. Fauci who said, I think it was one of our leading doctors, you know, said basically that, now it was another doctor, can't think of his name, but anyway, basically said that the mask in some respects is going to be more, Redfield, I think, mask is going to be more powerful than the immunization. I don't know about that, but it just tells you how much he thinks this mask is worth. And we saw it on our numbers. I mean, we can show you graphs. We can show you what happened when our early cities, for example, put on mask orders, and then we came in right shortly after that and put in a mask order for the entire county. And you can see what happened in those counties, and it's phenomenal. You started to seeing the mask wearing go up dramatically, and then you started seeing cases go down. Now, it doesn't mean they don't struggle. It doesn't mean they still don't have problems. But we know, we can show where the mask wearing in Ohio has fundamentally changed the outcome. And look, we're not trying to be alarmist, but if you're at a county with 2.5 times, 3 times the positivity, there's no way it doesn't get into your schools. There's no way it doesn't get into your most vulnerable people, and that is your loved ones, your grandparents, your great-grandparents, your aunts, your uncles who are in the nursing homes. So, you know, it's imperative, if you live in one of those counties, to get control of this virus. And it's not that hard. It is simply, you know, erecting barriers so it doesn't pass from one person to the other. And the best, you know, this is an amazing barrier. And when both people are wearing them, it's really, really good.
Next question is from Justin Dennis at mahoningmatters.com.
Hi, Governor. Mask mandate, since we're talking about masks, the mask mandate has been difficult to enforce at the local level. And if this is, as you say, our ticket away from the dangers of the pandemic, how can you strengthen enforcement measures? Is there anything new that we can do to ensure compliance, aside from leaving it up to everyone to make their own decision?
Yeah, I mean, we're going to, you know, where we have the most ability to control is frankly in any establishment that sells liquor, because we can send in agents, and we do. And if they're not following mask compliance or they're not following distance requirements, then those agents can cite them into the state liquor board. So in those cases, doesn't mean we catch everything, but we have the ability certainly to go in and to do that. But where we're seeing, you know, a great bulk of this spread is families and people just, hey, doing things that normally are great things to do. Our message is you can still do those, but you just got to be careful. And Fran, I've been to a few funerals in the last few weeks, unfortunately, and you can do them. You can do them safely, and everybody can. And you can pay honor to the loved one and see the family and do these things. But when you're talking about enforcement, there is a limit to what government should do, and there's a limit to what government can do. And, you know, we can't go into someone's backyard. You know, we can't go inside their home. We can't go inside that fraternity home. You know, these are things that we don't have the people to do it. But again, if we're going to get through this, and whatever you like to do, whatever's important to you, wearing a mask and keeping distance is the way to preserve the ability to do that. And we're going to continue to talk about that. And in events that we can control, sporting events, for example, you know, it's incumbent upon the people to enforce it, who run it. And when they don't run it that way, then there's a problem. So we can do this in some areas, but when people's most personal, private things, parts of life where we're seeing the most spread, frankly, it's tough. It's not easy.
Next question is from Tom Jackson at the Sandusky Register.
Hey, Tom.
Hi, Governor. Thanks for taking my question.
Sure.
As you pointed out, we're getting a big rise in cases, although fortunately deaths have not been spiking. Can you give me an idea on whether any lockdown measures are likely to be brought back this winter if things keep going south? For example, could there be more restrictions on bars and restaurants if your appeals for people to follow social distancing and to wear masks don't seem to be having any effect?
Yeah, I mean, I think there could be, but I think the more likely thing to happen is that the market itself, The people themselves will react. And I use the example of schools. We've seen some schools that started open 5 days a week who've now pulled back, at least temporarily, maybe to totally virtual or to a hybrid. Why have they done it? Well, they had some outbreaks. They had some cases. They couldn't put teachers in a classroom, or they were, had too many students who were out. So that's what's going to happen. This virus will have the impact right on the ground, right at the local level, and people will have to adjust to that. So, again, the best way to stop that from doing is people in the community to understand what they do directly impacts what goes on in that nursing home, or directly impacts what goes on in that school. I want to mention something about the deaths, because you make a good point. I think that, and I said this early on, if you can avoid, if you had to get this, you'd want to get it as late as you could in the game, because medical science is getting better and better. They're learning. They know what drugs to use and what things to use. There's no cure, but they can mitigate the damage and they can save more lives. So we would continue to expect, and I think our medical professionals would say this, that they will continue to expect to save more lives the further along in this that we go. But the other thing to keep in mind before we get too happy about how we're doing, or too optimistic, is that deaths are, of course, the last indicator. It's the lagging indicator. I mean, you go through a long process, and someone is infected. Someone then notices it, or somehow they take a test, and now they know they've got it. And at some point, they get so bad they go to the hospital, and then they may be in the hospital for an extended period of time. We hope they get out, but if they end up dying, that may be big a period of time. So they're the lagging indicator. So when you see these numbers as high as they are today, we may see those results, 2, 3, 4 weeks away. So we're doing better, not because of me, but because of what doctors and scientists are doing. But we're still losing people. And there's no cure that we know of.
Next question is from Jackie Borchert at the Cincinnati Enquirer.
Hey, Jackie.
Good afternoon. Governor, you said earlier that if we got to 80 to 90% compliance for wearing masks in counties, that would make a huge difference. Where are we at now, and how are you measuring that?
Well, that's a good question. There are some apps that are supposedly doing this. I've never been quite sure how reliable they are. I will tell you what we do. On this morning's 7:15 call with the health departments, I ask each one of them to report to us today what they think their mask compliance is in their community. And I'll be happy to share those with you all on Thursday. It varies, and it varies within the county. Here's what some of my district reps who I've sent out, and they're not health experts, but they just have gone out and just looked. And what they'll say is that in the rural counties, urban counties has the most compliance generally. You get out into the rural counties, the county seat has less than the urban areas, but more than the rest of the county. So you go into a county and the county seat will have the highest rate of compliance, maybe 40%, 50%. But then when you go out into the smaller communities, it may go down to 10% or less. It also depends on the type store. What they tell us is that grocery stores do pretty well. The highest incidence, the highest compliance level is probably in the grocery stores for whatever reason. Convenience stores, on the other hand, are some of the lowest, is what's reported to us. And this is consistent county to county. And I don't know why that is, but again, it matters. It makes a great deal of difference. We got frontline workers. They're not all in the medical field or the nursing home field. We have frontline workers who work in grocery stores, and someone's out stocking shelves and they've got a mask on and you don't, and everybody else doesn't. That's not fair. It's not fair to them. Really, it's not. But we'll try to get you that and at least share with you what we have. Again, it's not that scientific, but you can come fairly close, to knowing what's going on in the county.
Next question is from Jack Windsor at WMFD in Mansfield.
Hey, Jack.
Governor, follow up on last week. Since then, we've learned schools are not super spreaders, according to a Brown University study confirming what the CDC said in July. Lockdowns cause mass poverty, and the benefits of normal education outweigh risks, according to the World Health Organization. 85% of those who masked contracted COVID, while only 3% of those who didn't mask contracted the virus, according to the CDC. And then BioNext Now, the tests that you want to use in our schools, are approved for off-label use, but the test manufacturer does not recommend them for use on asymptomatic people and nearly all the children who are positive or asymptomatic. We're also receiving anecdotal reports of kids suffering infections, heart conditions, and kidney issues due to masking. And 10 months in, not one child under 18 has died from COVID. Governor, can you get kids back in school full-time without the dangerous demand of masking, unnecessary testing, and can we stop the unethical 14-day quarantine of healthy kids?
Well, Jack, my answer is probably the same as it was last week. I don't know that it's much different. We do know that kids can spread it. You use the term super spreading. It's a different thing. And what we're seeing where the super spreading events generally are at weddings, they're at when people are inside, they're people close together, they're when people are shouting, people singing, people crying. You know, these are places where we have seen a lot of the super spreader events. And so super spreader events we've not seen to my knowledge, in our schools. We have had some kids who get the virus. But we don't think that by and large, most of these kids are getting that virus in school. We think that spread in school is not huge. From what we can see, we think the schools are doing a very good job keeping that spread from taking place. As I said, we're going to use some tests. These tests, if you use them frequently enough, you can certainly get a pretty good indication of what is going on. And so we have not, in our schools, unless some child is symptomatic, testing has not been very widespread. So we get back to the question that many superintendents have raised to us. And they've said, Sally's sitting here, turns out that she's got COVID, say she got it from her dad or whatever, she's got it. Now we know that. Now we go back and see who she sat with. And for the schools that can't separate by 6 feet, this is where we get into the question. And we try to follow what the CDC said, and the local health department is trying to follow that. And what they have basically said is that, and they've said very specifically, that while masks are important, even though both parties are wearing masks, if they're within 6 feet of each other and they're together more than 15 minutes, that other person should be quarantined. Now, I understand why parents are upset. I understand why superintendents are questioning that. We went back to our health people, and not just work in the health department. I'm talking about people at major universities, hospitals, and to a person, they said, we don't think you can go away from that. We can't advise that without any data. So we're going to try to get some data. We're going to try to look at what kids who have been in that situation and testing them very frequently after that. Let them stay in class, let them stay in school, and see kind of what we come up with and see if they actually do develop that virus. The fear all along from the health experts, at least as I understand it, going back to when schools were closed, has been that particularly kids over 10 can, in fact, any child can get it, but children over 10 are more likely to be spreaders. And so you take that back, even if they have no symptoms, never know they've got it, they go take it back to their family and it spreads out from there. But we continue to learn, we continue to get data, and we're trying to inform what we do in Ohio by that data, and we're going to do our own experiment under the guidance of the Ohio State University and see what comes of that and take that information and help it inform what we do.
Next question is from Laura Bischoff at the Dayton Daily News.
Hi, Laura.
We'll come back to Laura. Next question is Adrian Robbins at WCMH in Columbus.
Hi, Governor. Thank you so much for doing this again today. We're learning more information on the plot to kidnap the governor of Michigan, including that the governor of Virginia was a target that was talked about. Does this concern you about your own safety? But also, when it comes to the rise of these extremist groups we are seeing across the nation, so including here in Ohio, are you concerned about the safety of all Ohioans?
Yes. As far as the last question, I'm concerned about the safety of Ohioans. Look, the rise in extremist groups is something that we have to be concerned about. FBI did a great job in protecting Governor Whitmer. But as far as all citizens, yeah, we have to be concerned about the neo-Nazis, the white supremacists, we have to be concerned about all of these fringe groups of right or left, whichever political side you say they're on, but we have to be very concerned about them. And, that's the thing that we as elected officials have to do is, denounce them, as I have, and I will continue to do so. So yes, I'm concerned about them. I'm concerned about it. Sometimes it's a one-off. It's one person. They get this in their head, and they're going to do something. Sometimes it's, as in the case apparently where Governor Whitmer was the victim or would have been the victim. It's a plot. It's a whole conspiracy. It's a group of people who apparently trained for this and were, so audacious that they thought that they could pull this off. So look, as far as my security, we don't talk about security. So I don't talk about our security. So it's just it's not a wise thing really to do.
Next question, we'll go back to Laura Bischoff at the Dayton Daily News.
Hey, Laura.
Can you hear me now?
Can hear you well, thank you.
Excellent. Hey, it's been 85 days since Larry Householder and 4 others were arrested in that $60 million bribery and racketeering case. Ohio lawmakers haven't moved yet to repeal or replace House Bill 6. I know you've called for it to be repealed. The select committee in the House didn't meet last week. It's not meeting this week. What kind of discussions have you had with legislative leaders about the future of that law in recent days?
Sure. We've certainly have talked about this, about the importance of it passing, that it needs to pass. I get the impression that the lame duck session may be a very interesting session, and I hope very, very productive. As I said at the beginning of this, we've got some language that we need to include in the code in regard to repeat violent offenders. There's police reform that needs to take place. I think there's a broad consensus among police officers and others, police organizations and community groups. So there are things that we should be able to pass in the lame duck, that the legislature should be able to pass, and I would be willing to sign, want to sign. So we hope, I certainly hope that this is one of the things that they deal with. So my position has not changed, Laura.
Next question is from Alex Ebert at Bloomberg.
Thanks for your time, Governor. Last week, the United States' second largest movie theater chain said it was going to temporarily close down. I'm a big fan of taking my daughter out to the movies, and I'm sure everyone in Central Ohio has seen the AMC over at Easton Town Center. Is there anything the state is going to do to try to prop up movie theaters and theaters in general during these hard times to prevent them from closing? Thank you, sir.
Yeah, well, Fran and I love movies and love taking grandkids, love just going. Fran and I, we go to the Little Art Theater in Yellow Springs. We go to other places. So it's always something we enjoy very, very much. We do have, we can't announce this yet, but in the money that we're setting aside, we hope to have money, we'll have money for theaters, performing arts theaters in Ohio. And look, it's not going to put them back where they were or where they would have been, but we will have money in there for that. I don't anticipate money directly for movie theaters, although they may qualify under something else.
Governor, next question is the last question today, and it belongs to Marty Schladen at the Ohio Capital Journal.
Hi, Governor. How are you?
I'm good, sir.
Good. You are undertaking a process to make Medicaid more effective in Ohio and bring about better health outcomes. But at the same time, you're supporting a nominee to the Supreme Court who's going to have a vote on the ACA on, well, if she's on the court sometime after November 10th. And she's been critical of earlier jurisprudence upholding it. Are you concerned that she may strike down the ACA and that about 500,000 Ohioans who are covered under the expansion population might lose their insurance, in addition to all the people who have protections for their pre-existing conditions now that they might lose?
Yeah, thank you for the question. I think there's a real consensus in this country and among members of Congress, governors, the pre-existing has to be covered, that nothing that hole has to be filled, has to be covered. Keeping insurance until your child is 26 has to be covered. There are other things that clearly have to be covered, where I think that we have emerged in this country, there has emerged clearly a consensus. Judge Barrett, I believe, is a stellar candidate. I didn't watch much of the hearings today, just kind of walked by the TV a few times and saw it, but looked like she was holding her own and doing well. She's eminently qualified. She has a great background. I think she'll be a great justice. And I think we're done. Look forward to seeing everyone on Thursday, and hope you have a good rest of the day. Thank you very much.
That was Governor Mike DeWine wrapping up his Tuesday coronavirus press briefing. Let's take a look at the numbers on coronavirus.ohio.gov, since we did not get that opportunity before the governor started speaking this afternoon. Here's a look at the page right now. Let me make it full screen for you guys. You can see, again, as the governor mentioned, over the past 24 hours, there have been 1,447 new cases reported. 21-day average is continuing to rise across the state of Ohio. It is now over 1,200. Over the last 24 hours, there have been 12 deaths reported, and that is below the 21-day average of 18. 123 new hospitalizations reported within the past 24 hours. That is a significant amount, especially compared to the 21-day average of 79. 13 ICU admissions as the page refreshes, and that is also above the 21-day average of 11. Again, this is all the information that you can get on coronavirus.ohio.gov. You can go to different pages here, check out the overview, check out the curve that we have going on. You can see really kind of an up and down plateau as far as the cases go, and it gets smaller right here because they in order to get a more accurate curve, they backdate with the most accurate information as to when somebody actually got the coronavirus, as opposed to when they got that data from the county health departments. And that goes for cases, hospitalizations, deaths, and then we have 140,000 plus presumed recoveries in the state. All right, guys, that's all that we have for you guys this Tuesday. We'll be back on Thursday for the same thing, a regularly scheduled press conference coming up in just about a half hour. You can hear more from Adrian Robbins, who is at the State House, on what the governor had to say today as well. We'll see you all in about a half hour on the broadcast side of things. Bye.